welcome everybody. I'm your host, Bess Hour, and welcome to Plant-Based Telehealth Live. We've got an amazing guest here today. You probably already know him, but we have Dr. Michael Klaper join us. Dr. Klaper, thank you for taking time out of your day to join us.
Oh, you're so welcome. It's great to be with you and the viewers.
First I want to ask our viewers, where are you tuning in? I see them already chiming in. We have Janet from Seattle. We have Kimberly from Prescott, Arizona. So guys, let us know where you are watching from. And if you have questions for Dr. Klaper, please put them in the comments and we will get to them. But first, Dr. Klaper, you are one of the leaders of this plant-based, I hate to call it a movement, because a movement sounds temporary. And this is something that really should be a permanent lifestyle for us. But for many people, they're latecomers to it. So for you, you've been doing this for a while. What led you to kind of discover this miracle of plants?
Well, I was a classically trained physician. I graduated from the University of Illinois College of Medicine in Chicago, and for the first 7 years of my medical career, practiced plain old blood and guts medicine, emergency rooms, operating rooms, and my own general practice office. And as much as I enjoyed working with the patients, I was getting very discouraged. Not only weren't people getting healthier, they were getting sicker. They were getting more obese and clogged up, and blood pressure's going up. And then I get the call from the ER that Joe had a stroke. And I think, what kind of doctor am I? My patients were all doing worse. And I didn't know what to tell them. And for the first 7 years of my practice, I spent it chasing numbers, chasing this one's weight's going up, this one's high blood pressure's going up, this one's my blood sugar's going up, and I'm just chasing these numbers, raising their dosage of insulin and hypertensive medication. And I got so discouraged, I left general practice and I went in to become an anesthesiologist. And I did almost 3 years as a resident in anesthesiology. And find myself on the cardiovascular anesthesia service, where people have their hearts and blood vessels fixed. And day after day, I'm putting people to sleep and watching surgeons open their chests and open their arteries in their heart and pull this yellow guck out of their arteries called atherosclerosis. And there was already studies in the medical journals back in 1980 and late 70s that you can melt this stuff away with a plant-based diet. I was aware of that. And I had a real interest because my dad died of clogged arteries. I know I've got those genes, and I knew if I didn't adopt a plant-based diet, I was going to be on that operating table with that striker saw going up my chest. And so I adopted a whole food plant-based diet. My body loved it. Within 12 weeks, a 20-pound spare tire of fat melted off my waist. My high blood pressure went to normal. My cholesterol went to normal. My blood sugar went to normal. I felt great waking up in a nice lean body every day. And at that point, I realized I didn't want to be an anesthesiologist anymore and spend my career putting people to sleep. I'd rather go back to general practice and help them wake up. And so I did, much to my parents' dismay, as I left with 6 months to go in my residency, and went back to general practice. But now I knew what to tell those overweight, diabetic, hypertensive, clogged up patients. I found people in the area who would give plant-based cooking lessons and sent my patients to them. And those who could change their diet experienced the same wonderful changes I did. They got leaner, their high blood pressure came down, their high cholesterol came down, their sugars came down. And I was able to prescribe their medicines. I was getting calls from my patients with high blood pressure. Hey, doc, I'm standing up and getting lightheaded. Is this medicine too much for me? Yes, it certainly was. And I was able to reduce this medicine and then stop it altogether. My patients with type 2 diabetes were calling saying, Dom, I'm waking up with blood sugars of 40. I cut your insulin in half. It still was 40. Cut it in half again. And finally, I said, stop your medications. You don't have type 2 diabetes anymore. When I said those words, I thought there'd be a puff of smoke, and the ghost of my internal medicine professor would say, what did you say? But it never happened. And, that was in the mid-1980s, and you can't unring the bell, once you know that this is possible, there's no other way to practice medicine.
Right. And oh my gosh, what an amazing testimony to have seen it personally. So we are getting a little bit muffling of your microphone, and I was noticing it. So let's see.
High-tech Shure 7 microphone, deluxe microphone here. I don't.
Perhaps
Hopefully,
try.
is this any better now that I'm much closer
No,
to my mouth? Nope.
no.
Not.
So it sounds like it's the connection. Are you able to unplug and then plug it back in, perhaps? Can you hear us now? So that stopped the muffling, but we are going to need you to, did you plug it back in now? All right, now we have no sound from you, but it was really making some staticky noise. Hey guys, if you're staying with us, so we'll get Dr. Klaper back on in just a minute while we work out the audio. What I want you guys to do at home is in the comments, if you are already on a plant-based diet, I want you to say yes, if you're already following that plant-based diet. If you're not yet, I want you to put that you're curious, right? The word curious. And if you're not at all, put in no. So either yes, you're doing plant-based, curious if you're just kind of wondering about it, or no, you are not yet. So go ahead and do that for us. Dr. Klaper, are you back yet?
I'm back. Can you hear me?
Perfect. That sounds clear as day. Thank you. And I apologize for that. This is
I'm sorry. Change microphones.
Yeah,
Okay.
yeah. And we got exactly your whole story and the changes that you were seeing in your patients, and just what a testimonial. So I know that I've asked our viewers if they're already following a plant-based diet. I'm seeing a lot of yeses. Yes, for 40 years from Lulu. Yes, cholesterol still high. Weight and low blood pressure 74. Feel wonderful except for the cholesterol. So maybe I'll put that, Judy, as a question. So maybe Dr. Klaper can maybe comment on that. Yes, 20 years of whole food, plant-based, salt and oil free. So yes, with a few stumbles, absolutely. And the audio is great now. So thank you so much, Dr. Klaper, for that. All right. So when you and I first came on before we went live, you said you were here to spread the good news. And so I want you to reiterate the last part when the microphone got a little bit fuzzy, that you had a patient that was on medication that started having such great results that you were able to actually remove them from medication. I mean, is that what you typically see with some of your patients?
Oh, absolutely. One of the joys and the beauties of telemedicine is that it introduced me to the whole concept of de-prescribing. I mean, we docs are really good at pulling out that prescription pad and prescribing medications. But there comes a point as the patient's getting healthier on a plant-based diet that their diabetes or blood pressure are going away. And you need to back down those medicines. And there's a proper way. There's a zen of de-prescribing medications. And all the docs at plant-based telehealth are well familiar on how to reduce these medications. And what a gratifying, exciting moment in medicine, in medical practice for the physician when I'm able to stop these medicines, and certainly for the patient. So it's just, I'm the happiest doctor I know because my patients get healthy, and we learn how to de-prescribe these medications. By the way, I have quite a number of long-term vegan plant-based patients with high cholesterol levels. Won't go into it now, but if you go to my website, drklaper.com, doctorklaper.com, I have a video there called Beyond Cholesterol, and I go into why why that may be happening and what to do about it. So yes, there's my website. Go to see my video. It's a little 30-minute video to those vegans with high cholesterol. You basically not to worry about it. Your own liver is putting that cholesterol out for a reason. It's not the same cholesterol as Joe Six-Pack eating cheeseburgers and buffalo wings. He's got a different kind of cholesterol there. But if it's all from your liver, the odds are it's not causing you any diseases. But there are tests that you can do to determine that. It's all in my video, Beyond Cholesterol.
So I've got your website pulled up, and as you said, I've got the URL at the bottom, guys. If you look at the bottom of the screen, you'll be able to see drklaper.com, and he has all sorts of answers, articles, videos, free video and audio. So definitely check it out. If you then would like to make an appointment with Dr. Klaper, plantbasedtelehealth.com. We are your gateway, your portal to doing so. It's really easy to make an appointment. Just go down to the new patient registration, you fill it out, and then you register for either a 30 or a 60-minute consultation. And if Dr. Klaper is not in your state, because that's the one thing, you have to make sure you find a doctor that is licensed to practice in your state. We've got most likely somebody who is. So you can take a look at all the doctors we have here and find one that is in your state and that is a good fit for you.
I have to smile as I saw the pictures of my colleagues and my teammates in Plant-Based Telehealth go up there. We were just out in California at the Plantrition Project meeting, and most of the telehealth docs, we converged there. We finally got to meet each other in the flesh. We're mostly just squares on the screen there. And they're just lovely people. I've known that all along, but it was just a thrill to be with them in person. And I can tell all your viewers that no matter which of the plant-based telehealth docs you get, you're going to get a fine physician and just a wonderful person. So find a doc with licensure in your state and make an appointment. You won't regret it. They're excellent physicians.
In fact, we just got a shout out for one of your coworkers. That's Dr. Nikki Davis. She's wonderful. Oh, fantastic. And I heard, correct me if I'm wrong, that you all frequently use your fellow doctors there to conference with. If there's something that perhaps one doctor is unfamiliar with, you'll conference with the rest of them. So not only are we patients getting access to your big brain, we're potentially getting access to a lot of doctors.
Indeed, we have a section in the email facility for the doctors, for members of the staff. And every week or so, there'll be a message, hey, anybody ever have a patient with XYZ here? Any ideas how I can better serve this patient? And everybody chimes in because among the 11 of us, somebody's seen that condition before. And we often can contribute some meaningful advice. So one of the beauties of working in a plant-based telehealth community practice.
Oh, I love that. All right, guys, let's get to some questions. So we've already got 11 questions lined up. Now, I have to caution you. Dr. Klaper has not examined you personally. You have not been in with a consultation for him. He has not reviewed your history. So none of this can be taken as a direct medical consultation. But Dr. Klaper, I certainly hope that maybe perhaps you're able to answer in generalities or trends to let them share some of your knowledge with them. Great, great. So let's go ahead and look at this. We have from Elise. Dr. Klaper, if you eat a whole food, plant-based diet, and your sources of fat are only from whole foods, such as flax, chia, tahini, etc., is it okay to have approximately 30 to 35% of them from fats? So can your diet be a little bit higher in fats if they are whole food, plant-based fats?
I think it's probably okay. It's difficult to play the numbers game. Everybody is different, and various foods have different availability of the fats, etc. But one of the beautiful things in this question is that the fats are from whole foods. And when you are eating ground flax seeds, the micro droplets of flaxseed oil are firmly attached to the fibers of the flaxseed. And when you eat it, even ground up, goes down there. It takes hours for the digestive enzyme to penetrate that little piece of flaxseed, and for the amylase enzymes to break up the starches, and then the lipase enzymes to emulsify it and allow the absorption. And as a result, the amount of fat in the blood goes up very slowly. One pass through the liver, pretty much taken out. So fats in their whole form are pretty physiologically benign. Now, I saw there was tahini there, and that's much more absorbable. That's already tahini butter, sesame seed butter. But the fats that are in olives and avocados and walnuts, as long as they're in their whole form, they're going to be absorbed very slowly, and the adverse effects, I think, are going to be pretty small. So don't push it past 35%. That's where you get a little heavy there. And don't be eating handfuls of nuts, etc. Hold it them to very modest amounts. But if you do so, I think you won't get in trouble with fats in their whole form.
Fantastic. Great information. This one's from Jeffrey. It's a little bit longer. Jeffrey, I've been a whole food plant-based for about 7 years, age 71. Recently, my total cholesterol 1 year went from 154 to 175, and LDL from 86 to 106. My blood pressure is low, 100/68, triglycerides low at 103 with no diet animal products, period. My BMI is 22. I feel great, but my cholesterol numbers driving me bunkers. And you touched on this just a little bit earlier.
Right. Bless you, Jeffrey. I get 3 emails a month from people just like Jeffrey saying the same thing. I've been plant-based for 10 years. Why is my cholesterol going up? There are reasons, one, we don't understand, but as I mentioned earlier, every one of those cholesterol molecules in Jeffrey's bloodstream is put there by his own liver for its own reason. Cholesterol is not an evil molecule. It is your hormones are made out of it. Your adrenal glands make cortisol out of it. Its testicles make testosterone out of it. Your liver makes bile out of it. Every cell uses it in the cell membranes. Cholesterol is not an evil molecule, and his liver is responding to its body's needs to make cholesterol. Now, that same cholesterol in a cheeseburger guy eating a standard American diet, every other molecule of cholesterol in his bloodstream is cow cholesterol and chicken cholesterol and pig cholesterol, and it comes in with all the advanced glycation end products and free radicals and French fry oil and all the injurious molecules in that Western diet. And those are the molecules that injure the endothelial lining of the artery, and very importantly, by cooking cooking the meat, by grilling the burger, by broiling the steak, you're oxidizing the cholesterol in the animal's muscle, and it's that oxidized cholesterol that is being eaten that gets into the wall of the artery through that injured endothelial lining and starts setting off the plaque formation. This is totally different. If you're just eating rice and beans and greens and fruits and veggies, a whole food plant-based diet, there's no reason your endothelial lining should get injured, and there's no reason you should start developing atherosclerotic plaque. I tell the cardiologists, you guys have stopped being biologists. Plaque formation is an active biological process. You become these fear-filled technicians ricocheting off these numbers because you're afraid of getting sued if someone has a stroke and you don't have them on statins. And the point I'm trying to make is there's a difference between a benign hypercholesterolemia, where the liver needed to put out 200 milligrams of cholesterol in your bloodstream, versus the disease of atherosclerosis, which is an active biological process inflicted upon the arteries by the owner of the arteries, abusing it through foods he shouldn't be eating. Now, in the cardiologist's mind, everybody in his waiting room has clogged arteries and they've got high cholesterol. Therefore, the problem's the cholesterol. No, doctor. The problem is an inflammatory damage process to the artery walls. So if you come to plant-based telehealth, we will order a set of inflammatory markers that go up as if plaque is really being formed. You're going to get a whole series of inflammatory markers, high sensitivity CRP, myeloperoxidase, phospholipase. If these are normal, and you get a carotid ultrasound scan of carotid arteries and there's no plaque, you do not have the disease of atherosclerosis. Relax, trust your liver. It knows what it's doing. And so there's a difference between, two people may have the same cholesterol number, but they mean totally different things. Get your inflammatory markers checked, get your artery scanned, and then sit back and relax. If you're a true plant-based eater and those tests are negative, you don't have the disease of atherosclerosis. Trust your liver, it knows what it's doing. Again, all that's spelled out with illustrations and the list of tests to get in my video, Beyond Cholesterol, on my website.
Oh man, what a thorough and yet easy to follow explanation. Thank you for that. So I hope that helped our viewers out, because several of them were mentioning that. We're going to change back to, we have Kimberly here. If you see blood glucose on the rise 3 hours after a meal, you look at the basal insulin or a high-fat meal, stressful event, lack of activity the day before, what exactly would you look at?
Oh, it depends how high the glucose, right? Glucose is supposed to go up and down. Now, if you're eating too much fat, it goes up and stays up. You start inducing insulin resistance. But if 3 hours after eating an apple, your blood sugar is 140 or whatever, yeah, there was probably fat, too much fat in your diet either that morning or the day before. It means just lighten up on the fat. That's the usual cause of the insulin resistance. The odds of it suddenly being an insulin deficiency are small. But if that sugar's just staying up, or and you're waking up with high blood sugars, yeah, then you need to get your insulin secretion checked and all stuff. And the docs at plant-based telehealth know how to do that. So it's common, as they say in medicine, common things are common, and it's probably just too much fat in your diet there. So have an honest look at what you ate that morning and the day before, and see if you can free up your insulin receptors. Go for a nice walk; that usually cleans them out as well. Now,
I'm muted. Sorry about that. I'm going to remind Molly Ann that Dr. Klaper has not reviewed any of your records or your child's records, so we can only answer in generalities. What are your thoughts on the need for supplements? My children's pediatrician recommend multivitamin and probiotic for my 10-year-old who's complaining of fatigue. His labs are all normal, including thyroid. She did test positive for a history of Epstein-Barr, though.
oh my. Well, certainly all kids would benefit from. They must be on vitamin B12 if they're truly plant-based. If they spend all day inside and their vitamin D level is low, I would get that vitamin D level up well over 30. And you can make a case for those nutrients that their rapidly growing bodies absolutely requires. It is in food, but I'm talking about zinc, vitamin K2, DHA, essential fatty acids, omega-3s, etc. And I have no objection to a multivitamin that's got a modest amount of each one of those. Now, the fatigue is something else. And the most common cause of fatigue in a child or adult is fatigue, not getting enough sleep, and being up all night looking at the cell phone and doing homework and worrying about everything in the world that 10-year-old kids worry about. And if they're only making, say, 5 or 6 hours sleep at night, that's the most common cause for that. And so you really need to find out what's going on. And when you say fatigue, I said, Mom, I want to go take a nap kind of fatigue, or my legs feel like lead. I just cannot play this game. And those are two different types of fatigue. And the first one, again, is more of a rest and nutrition issue. If it's a muscular fatigue where they just cannot participate in sports, whatever, then the pediatrician needs to send them on to a neurologist or someone dealing with nerves and muscle function there. The Epstein-Barr virus, 90+% of the people are positive to Epstein-Barr. That poor virus has been blamed for so many things. And I'm not minimizing it. It's associated with some nasty conditions. But as far as I know, there's no cure for it. There's nothing to do but eat good and stay healthy.
You mentioned B12, and Christina actually has a question about that. How to get enough B12, iron, etc. from plants only. Do I need to supplement, or is it better to eat seafood 2 to 3 times a week to meet those needs? So you answered a little bit about that already. Is there anything to add to that for Christina?
Absolutely. One, you do not need to eat seafood ever. I suggest you don't. Those lobsters and crabs and oysters are scavengers. They're the insects of the sea and are on the bottom, and there's a steady rain of pollutants coming down, pesticides, herbicides, heavy metals, and it accumulates in the crabs and the oysters and the clams and lobsters. Do not eat seafood. It is not healthy. It is contaminated and full of mercury that can cause autoimmune disease, etc. That said, vitamin B12, yep, you need that. Get that from a plant-based supplement, fortified soy milk, a little tablet under your tongue. But we've lost our natural B12 sources due to modern sanitation. You need to take some B12. Iron, if you're low, one, stop eating dairy products because that might be causing heavy menstrual periods, and the iron loss may really be setting you up for iron deficiency. And second, you want to eat iron-containing plants, dark green leafy vegetables, but to increase the iron absorption, put some vitamin C on them. That doesn't mean taking a tablet. It means if you've got broccoli or kale in front of you, squeeze some lemon juice over it. If you're making spinach salad, throw some mandarin orange slices in there. Get that citrus and greens combination going, and you'll absorb more of the iron that's in those dark leafy greens. Beet juice, dried fruit has iron in it. No reason to consume seafood for iron or B12 at all. And I really urge that you don't.
Fantastic. We have one from Jerry Ann, along with the whole supplementation. That seems to be a big buzzword today. My iodine is low. Is this common with a whole food plant-based diet, and what should I do?
Good question. And the answer, yes, it is common. We're not eating fish, so we're plant-based. It's time to let the oceans heal. We're not eating fish, but that's where we get our iodine. Well, it's in all sea products, including sea vegetables. And there's a couple of tasty sea vegetables that you can get. Organic on the Atlantic side, away from Fukushima. Wakame, which is a green seaweed that in the Japanese restaurant salads, GABA, that thrown into your soup or your salad 3 times a week should give you enough iodine. Aramay is a dark stringy seaweed. Again, a GABA that thrown into your soup or salad will do it. Sprinkling kelp powder a little bit, not a lot. There's a lot of iodine in kelp, but a little sprinkle of kelp powder on your salad. Or just chewing up a piece of dulse 3 times a week. They'll give you enough iodine if you want to do it from food. But I have no objections to a pinch of iodized salt on your veggies at the table as a decent way to get it. And if you are taking a multivitamin, have a look on the label. You should see iodine, 150 micrograms, or it's in that ballpark. Either through sea vegetables, iodized salt, or a supplement, yes, get some iodine in it. It's a real thing.
Okay, excellent. This one's from Jan or Jan. I'm not sure which one it is, but making sauces with cashews and walnuts and also using avocados and soy products. Are those going to cause issues with your arteries? I have a genetic high cholesterol and I've been whole food plant-based since January, but my LP is very high. I'm afraid to eat the avocados and the soy products in the nuts. What are your thoughts?
This person is an excellent candidate for that battery of inflammatory markers. There are 6 of them to measure, and I would send this person over to the ultrasound store and have them get a carotid artery scan, and then we'd have a talk. If his markers are high for inflammation, or if he's got plaque in his arteries, boy, he needs to back off of all those kind of foods he mentioned. But if his inflammatory markers are stone cold negative, his carotid artery shows not a hint of a plaque, he doesn't have the disease. It doesn't seem to be hurting him. But he should still be modest with those high-fat foods, and don't be pouring cups of tahini dressing on your salad. We're talking about a tablespoon or 2. But if it's done in modest amounts, I don't think those fats per se are particularly hazardous to him.
Okay, excellent. Joseph asks, I'm whole food plant-based NO for about 2 years now. My homocysteine level is 15. How can I reduce it? So bummed.
Joseph, all is not hopeless, but you are right to be concerned, as am I. I tend to run high homocysteines as well. And in order to get it down, you need 2 vitamins, vitamin B12 and a form of folate. It's in dark leafy greens, but some of us have enzyme issues where we don't detoxify the homocysteine with those vitamins as well as we need to. So 1, make sure your vitamin B12 level is between 600 and 900 micrograms on your blood test. Eat lots of dark leafy greens for the folate, but there is a product, and there's a number of them on the market. One is called Homocystex. I have no connection with the company, but it's a special form. It's methylcobalamin B12 and it's methylfolate. And those are the 2 very active forms of B12 and folate that, when taken together, usually drop the homocysteine down. So look for a product called Homocystex. But look at the ingredients. You'll see it's methylfolate and methylcobalamin. And if you can find it in a cheaper version, the formulation is pretty much the same. But yes, you need a special form of those vitamins to keep your homocysteine down. I would get it checked about twice a year. You don't want that thing creeping up on you to 16, 17. It can really injure the arteries and set you up for problems.
All right, so we are at 3 o'clock right now. So we are a half hour in, Dr. Klaper. How is your time going? We can either do a rapid fire on the few remaining that we have left.
Sure, let's do that.
Okay, all right, so here we go. Avtar asks, consuming flax and cinnamon, I notice my anxiety levels increase. I become fairly restless. Does that mean I'm allergic?
Yeah, I wouldn't use the word allergy. That implies histamine release and runny noses, all that stuff. But you clearly have a sensitivity to it, and these are just not good uh, uh, flavorings for you right now. They probably change the microbiome organisms, and they in turn put out byproducts that make you feel not great. Just don't eat them for 6 months, 12 months, 18 months, and then try and add them back in a little bit. You maybe find that you're absolutely able to tolerate them. Plus, your life will have changed by then. Your anxiety level's probably down anyway there. But give it a 12 or 18-month break from those two spices.
All right, the next rapid fire is from Brian. I plan to have my LPA check next blood test. I've been eating whole food plant-based for 10 years and wonder if the number turns out to be high, should I be concerned?
I don't think so. I've talked to Dr. Joel Kahn, a cardiologist, about this. He wrote a little book about Lp(a), and there isn't much. It doesn't respond to much of anything. It's pretty much a genetic marker there. It just means he's saying if you've got it, then your diet should really be whole food, plant-based. Don't eat the standard American diet because it's going to set you up for plaque formation sooner. But if you're already whole food, plant-based, I never check mine because it doesn't matter. If it doesn't. If it's not going to change your treatment, don't order the test, as they say in medicine. And the same thing here. I would not worry about it. Just keep your diet really healthy and you should be fine.
All right, we're going back to stress now. Kipper asks, can you please address the effect of stress, cortisol, on cholesterol? I've been plant-based most of my life, yet super stressful life, we're sorry about that, Kipper, has driven the cortisol and cholesterol to scary ranges.
Oh my, welcome to the 21st century. And I feel bad for this person. We're not here to suffer and spend our life in fear, but it's easy to do. So what to do? I can't tell you, how to reduce stress. Is it raise your cortisol level? Yep. Does it raise your cholesterol level? Possibly. Stress less. It's cruel, for people to make that implication. You don't want to walk around with high cortisol levels month after month, year after year. It's hard on the body. So whatever the cause of the stress is, work to solve the problem at this point, and don't make your body pay the price, and don't beat up any of your adrenal glands.
Excellent, excellent. All right, so this one is from Elise. It's all about soy and its benefits, talking about isoflavin content. I know the various soy types have different amounts. Does edamame have as much as full-grown soybeans? I've not been able to find a reputable source of isoflavin content levels.
I'm not a soybean physiologist here. Does edamame has as much as full-grown? They're pretty much full-grown soybeans. They're young soybeans, I agree. But you eat usually a fair amount of them. You eat a half a cup of them. If you order edamame at the restaurant, you're going to be eating a good half cup or so. Even though each individual soybean may have less, the total amount you eat is probably going to be a nice dollop of isoflavones. So enjoy edamame a couple times a week. But you're going to have a little tofu, a little tempeh during the week. So modest amount of soy products ought to keep you well cooked as far as, well served as far as isoflavones. It's not a matter, like Dr. Colin Campbell told us in his book, Whole. It's the whole food stream. It's not this nutrient and that nutrient. It's the whole food stream moving through your intestines, moving through your physiology. Just make sure there's some soy in there a few times a week. The isoflavones will take care of themselves.
All right, we're down to our final 4 questions. Tina asks, what do you do if you have moderate plaque buildup as shown by a CIC scan? Will following a low-fat, whole food, plant-based diet help dissolve that?
Absolutely, it will, and you must do it. It's the moderate plaque that can be the most dangerous. They're the most likely ones to soften and rupture and set off a clot, as opposed to the big calcified guys. So absolutely, you need to follow a whole food plant-based diet assiduously, and you need to read Dr. Esselstyn's book. Nuts and seeds are not your friend for the next year, and I have no objection to being on a statin for 6 months, 12 months, because it has an anti-inflammatory effect in artery walls, and then you get off of it. There's a limited role for those. But by far, year after year after year, it's the whole food plant-based diet that will melt away that plaque and keep you from getting a heart attack or stroke. So jump on the plant-based train, boots in, and really do it before you wind up with a stroke or heart attack or some other nasty problem from that plaque.
Life-saving tips right here. All right, we can pour us back with a real quick one. Can you consume too much nutritional yeast?
Yeah, I think you can. It has a bit of uric acid in it, or substances that can turn into uric acid, which can lead to gout and kidney stone. I love nutritional yeast. I would eat it by the spoonful if I could, but I know I can't. So I hold it to about a tablespoon a day on my spaghetti or whatever I'm consuming. So you 4 or 5 heaping teeth. That's probably too much, and it's obviously fortified. So you might want to get the non-fortified and alternate the two. One day use the fortified, one day non-fortified. So let that B12 come down. You don't want excessively high B12 levels. And again, the uric acid in the yeast itself can be problematic. So throttle back on your nutritional yeast to a tablespoon, 2 at the most a day. And that's where I would hold it if I were you.
All right, we've got 2 more. One is from Amy. It's about diabetes. For type 1.5 diabetes, not yet on any meds, eating fully plant-based and eating only 10 to 15% calories from fat. When the time for meds comes, would you recommend only insulin, or are there meds that preserve beta cell function? And if so, what are the side effects and are they worth it?
As far as I know, just stay with the insulin only. It's the easiest to regulate. It doesn't have the additional side effects that a lot of the oral agents have. Just go with the pure insulin, and hopefully, with your nice, lean, healthy body from your whole food plant-based diet, you're not going to need very much insulin. So just ride the insulin train. That's all you need to do at this point.
All right, and our final one, guys, is from Quentin. It's a little bit of a long one, but bear with me. Hi, Dr. Klaper. It's Quentin from Pena Pachama in San Francisco. I want to begin by saying that Dr. Klaper is one of the most honest and incredible doctors I've ever been a patient of when he had a practice in the Bay Area. I have not too serious autoimmune condition, lupus. I have really itching on the bottoms of my feet sometimes at night, or itching behind my ears. Is there an essential oil that I could use, or a natural product to calm this occasional but very intense itching?
Oh my. Hi, Quentin. Good to hear from you. And everyone, if you want a wonderful meal and a magical restaurant experience, go to Pachamama in San Francisco. They serve vegan food, South American style, from the heart. It's just a wonderful place to go. She's itching. Could be from the lupus itself, but dry skin itches in general. So you want to moisturize the skin. The best way to do this, as soon as you come out of the shower, when the skin is all full of the shower water, you want to lock that water in. So within 5 or 10 minutes coming out of the shower, take some avocado oil or some almond oil and massage that in. Hopefully you can lock in the moisture from the shower so the skin is more moisturized and hopefully less itchy.
Oh, man.
Say hi to Eddie.
All right, guys. So thank you for your questions. I see that since I called time, we've had a few more come in. I am going to hold us to the fact that we respect Dr. Klaper's time and his being here. I tell you what, though, we do respond to every comment. So you're welcome to put your questions in there. And even better, you can make an appointment and have Dr. Klaper all to yourself, or any of our wonderful plant-based lifestyle doctors. Just go to plantbasedtelehealth.com, fill out the new patient registration. It's really easy to make an appointment, and he will be happy to meet with you. If he doesn't practice in your state, make sure you choose one that does, and you will be on your way to accessing all these incredible brains and experience from our plant-based lifestyle doctors. Dr. Klaper, you have anything to finish up with?
Eat plants and laugh a lot. We're not here to suffer. We're here to be healthy and enjoy this life and get as much love and laughter in every day as you possibly can. That's really what we're here for. So do that. And if you have any problems with how your body's working, get in touch with one of us plant-based telehealth docs, and we'll help you enjoy your life even more.
Oh man, we're getting a lot of thank yous for your time. Thank you, Dr. Klaper, for being here. And Joseph asks, will there be a replay? Absolutely. So as soon as we go off live, you can watch it immediately on Facebook, or very shortly it will be uploaded to YouTube, where you can then watch it there if that is your preference. But really, thank you so much, Dr. Klaper, for taking time answering our questions today. So, and thank you guys for tuning in out there. And that's it. We'll be live next week with another great plant-based doctor from Plant-Based Telehealth. Until then, guys, have a wonderful weekend.
Great job.